And to open this session, we would like to invite Dr. Navneet Dhand, who is an associate professor in veterinary biostatistics and epidemiology at the University of Sydney. Professor Dhand also leads the Asia Pacific Consortium of Veterinary Epidemiology in 8 APAC countries. So without any further ado, we would like him to begin his presentation, please. Dr. Navneet, please.
Yes, thanks for the invitation. Can you hear me?
Yes, yes.
That's great. Let me turn on my video. All right, thank you. So I can move my slides forward now?
Yes, you should be able to, yeah.
All right, that's excellent. Thank you very much.
Thank you.
And thanks for the invitation for presenting here, and thanks everyone for joining. Dr. Vincent asked me to talk about the One Health approach and give some examples of the work that we have done using this approach. So I'm going to talk briefly about what One Health is, and then present 3 examples of the work that we have done involving One Health approach from different regions. So we know One Health, One Health concept believes that the health of humans, animals, and the environment is all interlinked. And so, the siloed approaches of dealing with these problems affecting animal, human, and environmental health are not going to work. So it requires that, we collaborate, communicate, and coordinate with each other for achieving better health outcomes for everyone. So, working together is key to One Health. But why do we need a One Health approach? One Health, we need this approach because of the complex problems that we are facing. For example, the emerging infectious diseases are increasing in incidence. In a report published in 2007, WHO indicated that these diseases are emerging at a rate that we haven't seen before. In the last, since 1970, we have seen about 40 new diseases emerging, including SARS, Ebola, avian influenza, swine flu, and more recently COVID-19. And an interesting fact is that more than 75% of these emerging infectious diseases, they originate in animals. So you can see that if you can't talk about the health of humans alone. So if you will have to, take the health of the environment and the health of animals into consideration if you want optimal health for everyone. So why these diseases are emerging? It's due to confluence of several factors. The population is increasing, and that is causing there's a need for housing and food for those people. So to meet that demand, we are causing deforestation, cutting down forests, and which brings wildlife in close connection with domestic animals and humans, which increases the likelihood of spillover of infections from wild animals to domestic animals and humans. On top of this, we have, to meet the demand for food, we have resorted to intensive farming systems, which are great for meeting the protein demand, but that also means that these animals are living together very closely, and it is much easier for pathogens to spread, as we have seen with avian influenza and swine flu, outbreaks. We also have exploitation of wildlife. Millions of wildlife are traded each year across international borders. That also brings wildlife in close connection with, close contact with the domestic animals and humans, which again, increases the likelihood of spillover of pathogens from wildlife to animals and humans. And on top of this, we have international travel. So if there is an outbreak that occurs in one region, or one country, one state, one city, it is quickly, spread to other countries and regions of the world, as we have seen with COVID-19 that just started in Wuhan, and then now it has affected almost all countries in the world. So you can see these are complex problems, and to deal with these complex problems that involve an environmental angle, wildlife angle, a domestic animal angle, and human health, we'll have to use One Health approach. But One Health approach is not just for tackling emerging infectious diseases. It can also be, it's also, equally applicable for many other disease problems, such, endemic zoonotic diseases. One example that I will discuss later today, and for antibiotic resistance, for food safety and food security. So anything that that is a complex multidimensional problems that requires interactions and collaboration and coordination between various agencies and people and working in animal, human health and environmental health sector, then One Health is sort of ideal approach to deal with that problems. So that's about the One Health approach, but I will now like to discuss some work that we have done using One Health approach. So the first example is from the hantavirus research work that we have done for early detection of emerging infectious pathogens. So I started at the University of Sydney in 2007, and at that time, the equine influenza outbreak was going on. It was a major outbreak that affected large number of horses in 2 states in Australia and caused a sort of situation similar to we are facing with COVID now. So I had just started there and then got the opportunity to work at the State Disease Control Center. And after the outbreak was controlled, I received some funding from this Rural Research Industry Research and Development Corporation to investigate the outbreak, to understand what worked and what didn't work, and to learn lessons from how we dealt with the outbreak. And I was fortunate to have Simon Firestone we hired Simon Firestone as a PhD student to work on the epidemiology of the outbreak. But we soon realized that, just epidemiology investigation is not sufficient because there were several social aspects to the outbreak. So we then engaged another PhD student, Catherine Sheeman, who worked primarily on the social side of things. So while Simon worked on conducting epidemiological studies, case control study, conducting spatial analysis, conducting network analysis, so typical epidemiological work. So Catherine worked, on the other hand, on the social side of things to understand what horse owners were doing and not doing, and what could have been done better. So between them, this project was quite successful, and between them, they published about it as an article and made a significant contribution to our understanding of how outbreaks should be controlled. But that then enabled us to again receive funding for another project in 2012 that focused on hantavirus. So what is hantavirus? If you attended the lunchtime seminars, you would have learned about, attended to talk from it, and then you would have listened to that. Then you would know, hantavirus is an emerging zoonotic disease that spreads from flying foxes to horses and from horses to humans, caused by a paramyxovirus. It was detected in 1994 in Australia, and since then has caused disease in more than 100 horses and affected 7 humans. So the numbers might be a little bit outdated. the disease is only sporadic, but it has a high case fatality rate, as 75% of the horses and 57% of the infected humans have died. As I said, it occurs only sporadically with occasional outbreaks, but it is a serious problem for horse owners as well as for veterinarians who have to deal with the infected, potentially infected animals. So this project aimed to understand the risk perceptions of horse owners and their to develop methods to mitigate their risk. And it was led by a sociologist, Mel Taylor, sitting here. And so this was a sort of One Health project which involved a number of different people from a number of different disciplines and was specifically focused on understanding the risk perceptions of horse owners. So one of the outcomes of this work was the finding of the the reasons for Hendra vaccine uptake. So similar to COVID vaccine, there are problems with the, so there is a vaccine available for Hendra in Australia, but the uptake of the vaccine is was quite low. So they conducted this investigation to understand why horse owners are not vaccinating their horses, and we found that that the horse owners were more likely to vaccinate if they thought that Hendra case could occur in their area. They were worried about and concerned about their family members, and they trusted the government. So that was reflected in their agreement with the establishment of a national horse registration scheme, and agreed that the Hendra virus case have been well managed. So if they had trust in the government, if they thought that Hendra virus could occur in their area, or if they were worried about themselves or their family members getting Hendra virus. And surprisingly, the perceptions and the factors influencing COVID vaccine uptake are not very different. So people are vaccinating, more likely to vaccinate if they think COVID could occur in their area, and they are concerned about their family members and they trust the government. And similar to COVID, they were less likely to vaccinate if they had financial problems. So these findings from sociological studies can apply across multiple diseases. So following on from that, we conducted another study to understand the effect of Hendra vaccine on horse performance, because there was rumors going on in the horse industry at that time that that horse and this Hendra vaccine reduces horse performance, and as a result, horse owners were not willing to vaccinate their horses because that's they're the bread and butter. So Catherine Sheeman, who is in the picture here, she was a postdoctoral fellow at that time, and she conducted an excellent investigation analyzing thousands of records of race records after accounting for several confounding variables, and found that there is absolutely no evidence of effect of Hendra vaccine on horse performance. And this work was then published in the Australian Veterinary Journal and helped to set at rest the concerns or the rumors that were circulating around at that time. So this project was funded by the Queensland Racing Integrity Commission. So following this, Ed Nand, who is a equine veterinarian, so came to me that they have problems in the field because more than 1,000 samples from more than 1,000 horses are submitted each year for testing for Hendra virus, but only occasional horse tests positive, but nothing is done for the samples that are negative. So the samples are submitted from horses that have neurological and respiratory symptoms similar to Hendra virus, but if Hendra virus is inactive, then these samples are just stored in the freezer and no more investigations are conducted. So Ed was wondering, what other pathogens are circulating in these horses that are causing neurological and respiratory symptoms. And if we try to investigate these samples further, we might be able to identify other pathogens that are circulating in them, but also they may enable us to detect those pathogens before they spill over to humans. So we potentially using horses as sentinels for detecting emerging infectious pathogens. So if you Ed has presented the details of this work in the lunchtime seminar, but ultimately this has led to development identification of a new Hendra variant that has now been picked up in a routine surveillance before it's spread to humans. And this is a media release from the Australian Agriculture Minister. So if you haven't listened to the full story, I would strongly recommend you to listen to the presentation recorded that Ed presented at the lunchtime seminar. But it was an interesting project where we involved experts from animal health, from social science, from public health, people who are interested in neurological diseases of children. So they all put together their energy and efforts to demonstrate that One Health approach can work and can yield great outcomes. All right, so moving on now to the second example, moving on from Australia to India, where I was born and brought up. So it is close to my heart. So brucellosis is an unlike a Hendra virus, it is a neglected zoonotic disease. It is still a zoonotic disease that spreads from cattle to humans, but there are not much, monies or efforts spent going on in controlling it. So it is endemic in many developing countries, including India. It causes abortions, retention of placenta, and stillbirth in cattle. And then infected cattle spread Brucella abortus organism. They are shed in uterine discharge and in normal discharge after calving. And then they're transmitted to vet personnel or farmers who come in contact with these pathogens or come in contact with animals during normal, procedures. So this is a veterinarian vaccine doing artificial insemination. So this is a very, very normal procedure done with very little PPE, and there's a very high likelihood of them contracting such infections if the animal is infected. So these diseases this brucellosis has been controlled eradicated in Australia and many other countries using, 3 approaches: vaccination along with extensive surveillance and test and cull approach. But this doesn't work that well in India because the surveillance is quite expensive and can have negative consequences, as a farmer whose cow is tested positive may sell that cow to another farmer, unsuspecting farmer, and that can actually result in spread of infection instead of controlling infection because there is no compensation given to the farmer. The test and cull program don't work in India because it is a Hindu dominated country, and Hindus considered cows to be sacred and their slaughter is banned in most of the states. So if we have a policy with vaccination, surveillance, and test and cull programs, you can see 3 wheels of a vehicle, and you remove 2 wheels, then you can see that how that vehicle can run. So there is a major problem there. So we started our collaboration with the University Gadavasu in India in 2015. With the aim to conduct studies to understand what can be done to control brucellosis and to develop a control program. So the ultimate aim of our collaboration was to develop a control program. So we worked systematically to understand the epidemiology and the economic impact of the disease, and so that we are able to develop a evidence-based control program. So this showed that the disease is prevalent in animals. So we know that the prevalence of the disease is 10 to 15% in cattle. And we then conducted studies in veterinary personnel to understand what is the prevalence of the disease in them, and to understand the risk factors of the disease, to get a better idea of the epidemiology of the disease in the veterinary workforce. And we found that about the zero prevalence was about 20% in the veterinary workforce. And that also gave us certain interesting insights into who was infected and who wasn't infected. So now we know that that the disease is prevalent in animals and humans. And the next thing, if you want to develop a control program, you want to convince policymakers, you would have to demonstrate that the disease has an impact on humans and animals. And we then conducted a study to understand the health impact of the disease in humans and the economic impact of the disease on animals. And we found that the disease causes a huge health and economic impact. So that gave us the confidence that there is a sufficient material for convincing policymakers that this is it's a major problem. But then we wanted to we started to think about what are the solutions. We know that the disease is a problem. It causes a disease. It has a huge impact, but what can be done about it? So we then conducted a cost-benefit analysis of 3 approaches to control brucellosis using vaccination, but in 3 different ways. And interestingly, all 3 approaches had a high benefit cost ratio. So which means that regardless of the approach that you use, if you use vaccination, that is going to produce good results. But the modeling showed that it will take about 20 years for vaccination to achieve the results. So now we had a pretty good understanding of the disease and how we can control it. Then we went to the stakeholders, veterinarians, our farmers, and policymakers to understand how with this knowledge, with this understanding of epidemiology of a disease, how this disease can be controlled. So what would work in the local circumstances under the local norms and conditions that are prevailing in India. So we conducted 7 focus group discussions with farmers, with the field veterinarians, with veterinary academics, and we had got really good insights about the problems that they are facing. And based on this work, we have published this paper on feasibility and acceptability of control strategies in India. And we have also developed a 10-point brucellosis control program, which hasn't been published yet. It has been submitted for publication in Acta Tropica. But this is the plan that we have developed that is based on the 5 or 6 years of work that we have done to understand disease epidemiology, and then to understand the social side of things, they understand the effective efficacy and suitability of approaches, control approaches. So all of this work was done in collaboration with medical scientists, medical people, public health experts, and social scientists. So it was a sort of true One Health approach, which involved multidisciplinary team. So as a result, we were able to recommend now develop this 10-point control strategy that hopefully will be, if implemented, will be able to control the disease not only in animals but also in humans, because most of the exposure to humans is through animals. And this is a new the popular article about this 10-point control program published in UNDRA. and I wouldn't claim, 100% claim for this, but, our work has also increased the recognition of the disease in India. And this is a tweet from the Prime Minister of India that they have sort of launched a special scheme to control foot and mouth disease and brucellosis. So brucellosis is now being talked in the same tweet as foot and mouth disease, which was, not used to happen before. All right, so that was about an example of development of a control program for a neglected zoonotic disease. And now moving on to Asia Pacific, about again strengthening veterinary epidemiology capacity to control emerging infectious diseases and endemic infectious diseases. So we. Some of you will be aware that field epidemiology training programs are running in several countries, and they the trainees, the field epidemiology trainees, they also called disease detectives. They have all helped in the have made a significant contribution in the COVID pandemic, but for controlling the pandemic and helping in the response. So these are this training model was developed by the US CDC in the early 1950s, and now they are running in more than 70 countries, and for training public health people. So veterinarians also started their own field epidemiology training programs in early 2000s, when actually happened in Southeast Asia in conjunction with the avian influenza outbreak. Because FAO started training people for tackling or controlling avian influenza in Southeast Asia. So that sort of morphed into a formal program, and now these programs are running in several countries. And the aim of this field epidemiology training program is to train veterinarians to conduct outbreak investigation and conduct disease surveillance. And so my association with these programs started in 2015 when the FAO asked me to organize field epidemiology training programs in East Africa, involving 4 East African countries. I really enjoyed that work, and that actually helped, influenced my career, as many of the work, a lot of work that I've been doing since then has sort of changed over to this field epidemiology training. So we, after organizing these trainings in Kenya and Tanzania, then FAO organized 2 workshops in Rome in 2018. The first one in February 2018, involving about 70-80 people from around the world to take stock of the situation of the current programs that are running in field epidemiology, to understand what is working and what is not working, and to make plans for future. And then they organized another workshop in July 2018, involving a smaller number of people to sort of brainstorm on what skills and competencies are required by field epidemiologists, so that there we can provide some consistency and provide some guidelines for field epidemiology training internationally. So after these workshops, then FAO signed an agreement with the University of Sydney to put it all together, and to with basically these 3 objectives: to review the existing programs in field epidemiology, and to identify the core competencies that are required to develop a curriculum that countries could follow, and to develop guidelines if a country wants to establish a new program. So this work has now been done and submitted to this FAO, and the people that were involved in that workshop were heavily involved in writing these guidelines, and this will be published by the FAO hopefully by the end of this year, and should be available on their website. But this work also enabled me to get some insights about the gaps in field epidemiology training programs, and what problems they are facing. So based on that, we submitted a project proposal to the department, our Australian government Department of Foreign Affairs and Trade. It's a Center for Health Security, for establishing Asia Pacific Consortium of Veterinary Epidemiology. And we were fortunate to receive this funding to strengthen epidemiology capacity in 8 countries in Asia Pacific, in Vietnam, Laos, Philippines, Cambodia, Indonesia, Timor-Leste, and PNG. And there is a sister program that is working in these yellow highlighted countries. So this EPCO involves veterinary epidemiologists from all schools of vet in Australia and New Zealand, and 1 school of the US, and has representatives from key international organizations, including the CDC, FAO, and WHO. And focused mainly on training animal disease detectives in outbreak investigation and outbreak investigation, surveillance, and One Health. So these are the main activities of EPCO. So the first activity is to develop e-learning modules and case studies, and then use these modules and case studies to train the animal health workforce. And then there are some training workshops for trainers to train them in One Health, in leadership and teaching methods. So for training, work has already started, and we are enrolling. So the online training will start in January next year, and we have already enrolled about 20 candidates from each country, and they will undertake our training for 6 months, and then they will undertake 5 of these candidates will give the best performing candidates will conduct field projects in their countries to apply these skills, and then 1 person from the field projects will be given visiting fellowship to visit Australia for further training. So these are the so we have developed 36 modules across 6 competencies, including outbreak investigation, surveillance, One Health and biosecurity, risk analysis, and leadership. So on leadership, we specifically included because these skills and communication, these are critical if you want to collaborate and coordinate, but with public health colleagues, with environmental colleagues. So all of these competencies would have 36 modules. So each competency, with, for example, outbreak investigation and response is a competency, has some modules, which we mean that they will give them, for example, information about how to conduct outbreak investigation. And then we have some case studies so that they can apply that learning for a particular scenario. So each of the competency has a similar structure. And to develop these modules, we organized 4 workshops last year, and then we created module teams, and they have been working very hard to develop these modules since then. And we have almost developed around 24, 25 modules, and hope to complete at least 25 to 30 modules by the end of this year. And then because the trainees are starting in January. And we also called for application for training, received more than 400 applications for 120 positions. And we have already selected 120 candidates from these countries, and they joined us a couple of weeks ago for their first workshop on just giving them an introduction about the program and how that would work. And so, as I said, the overall objective of EPCO is to train animal disease detectives objectives. So this is from our website, to protect both human and animal health. And so using the sort of One Health approach, focusing mainly on outbreak investigation and surveillance. And from the outset, we sort of focused on the One Health approach, and even our logo sort of represents the three color. The three color represent the that the health of the animals, humans, and the environment is critical and interlinked. And that's our family. So we have more than 45 people from all vet schools of Australia and 8 countries in the Asia Pacific, and this family is growing. So that's about it. And hopefully, we after this training, the veterinarian that we train will be able to improve the detection of diseases and improve surveillance and outbreak investigation capacities in the Asia Pacific. Thank you very much.
Thank you, Dr. Navneet. That was very interesting and very insightful. Any questions for Dr. Navneet? You all can type it in chat or raise your hand.
Yes, looks like there is a question from
from Helena. Yeah. Hold on.
Let me shut down my.
Is that me?
Yes, Hannah.
Yeah, great. Hi. Thank you very much for the really interesting presentation. I was just wondering about the app code. Sounds great. Really interesting endeavor. I was wondering about how you're working with partner institutions in the countries that you're covering, and how you're working to sort of make the training relevant to the work that's ongoing in each country.
That's a really good question. So from the outset, when we developed the program, we work with them from the outset. So from each country, we are working with either university organizations or government organizations. In some countries like Indonesia, we are collaborating both the government and the universities. So we have involved them in all sort of activities in developing the training programs and developing the modules. For example, we have developed 36 modules, and in each module we made sure that there is at least we have 4 members, 4-member team, 4 people working in each team, and there is a team leader, there is a team member, and we made sure that at least one person is from the target country, so that they can provide idea about what is the context. So these modules are all based on the context of Southeast Asia. So for example, we don't talk about disease in extensive beef farms in Australia. So they are all focused on the disease situation in Indonesia and Vietnam, in Philippines. So we have made efforts to take examples and case studies from our country partners. So they have been involved in that, and they will also be involved in actual training and project identification. And they will be part of a team, a committee, that one person from each country will be part of a committee. We call that training and evaluation committee, and that will meet every month to make sure that the training and the few hands-on project that people are conducting are relevant for those countries.
Thank you, Dr. Navneet. There's one more question from Isaac. He wants to know how this integrates with human disease outbreaks.
Yes, that's a really, really good question. So the training for field epidemiology for public health has been going on for a long time. Training for field veterinarians is sort of lagging behind. So this will enable field veterinarians, us to train our field veterinarians in tackling outbreaks and surveillance. And in one of the workshops, we are planning to put them together, bring people from public health as well as from animal health to see how they can work together in investigating an outbreak. So in a sort of a real life scenario. So hopefully, once they have these skills, So first, we are developing their skills in epidemiology, and also developing their skills in One Health and in leadership, so they're able to sort of work closely with their colleagues from One Health. So this program doesn't focus on training people from public health, but there are other programs run by various other agencies that are training them, and we are working sort of very closely with those people to make sure that the training that we provide, is beneficial for both public health workers and animal health workers.
Thank you so much. Any more questions? Okay, I think, thank you so much, Dr. Navneet, again.
No worries. Thank you. It was a pleasure. Thanks for the invitation.
Thank you. All right. So our next speaker